So coming out of Mohs surgery, it's important to realize that you won't immediately look like you did before the Mohs surgery. You can expect to have usually quite a few stitches in the area that you've had worked on. They can either be the dissolving type of stitches that you can't see very well, or they could be the type that you have to remove, which are usually brightly colored. You can see usually the lines that we cut, and you can see a lot of redness and swelling. Some of the swelling's from the local numbing that we injected, so that goes down quickly. Other swelling is just because of the tissue injury from the repair. It can already be bruised immediately after the surgery as well. Especially if there's a graft, it can be quite pale immediately after the surgery. And so when you're leaving the office, you have a pressure bandage on. Things are usually kind of swollen and tender and bruised. And we usually just have you go straight home and rest. Do some ice, do some Tylenol, just rest that evening. It is a process, and so after Mohs, your recovery, things kind of gradually look better and better. But oftentimes I will want to see the patients along the way to check in, because everyone heals at a different speed and in a different way. And so it's nice when I can keep checking in on them to see how things are healing, and then if we need to do anything else, we can. But usually the first follow-up visit is at the 1 week point. Many times in some areas, everything is totally healed, the stitches come out, and you're able to just resume normal activities and you don't need any further follow-up. But it depends, and especially, as I said, for the nose, sometimes you do need multiple visits and to check on things and possibly do some revisions down the road. But you won't always necessarily look normal at that point. As a matter of fact, the wound is usually still pretty fresh and still needs to heal more. And so at the 5 or 6 week mark is usually when we can start to tell how things are healing, to get a good idea of how the finished product will look. You can see some kind of lines where the incisions were and where the stitches were. Sometimes the lines are puffed up, other times the scar lines are kind of depressed. It just depends on the area on the face or how it's healed, of what that looks like. Depending on how it's healing, whether it's too puffy or too flat or it's just right, then we can decide on whether it needs an injection or sanding or anything like that, or sometimes it just needs time to continue to look better and better. But the 6 week mark is usually a good point to decide whether it's healing well and we don't need to do anything else, or whether we might need to consider something else in the future. Sometimes the scar can be revised, either the shape or the contour of it. Sometimes it can be sanded. It's kind of like a dermabrasion that's manual, where you actually kind of sand down the line if it's raised or if it's indented, to smooth out and make those lines disappear. Other times, if the scar is thickened or what's called hypertrophic, where it's puffed up, you can actually inject it with a steroid to get that to flatten out sooner. So at the 6 week point, if we do any kind of a procedure like the sanding or the injection, usually 2 weeks after that, I'll have them come back to reassess. And a lot of times it's much better or a lot better at that point. If it's not, or if we need to do more, then that's a good point where it's healed enough that I can go back and do a little bit more, either sanding or injection, or anything like that, because it's had a couple weeks to heal. It actually takes more like 6 months for the scar to mature, so that we can have a good idea of what the final outcome will be. I will say that surgery on the face is different than if you had to have Mohs on your ear or your neck or your back or any other part of your body. Based on the location, the healing times are different, the recovery periods are different, and kind of the expectations of how it needs to look in the end are slightly different. So for example, if the surgery is over a big muscle, like say the deltoid or the shoulder, then it's more like 2 weeks that we'll ask you to avoid exercise and heavy lifting and taking it easy. The repairs are usually a lot simpler and more straightforward and don't require as many revisions, even though those do take a longer recovery time. So it really is very site dependent on the kind of counseling you get and the kind of expectations you should have prior to surgery. Anytime you work on the upper face, a lot of times the eyelids will swell. Sometimes we've worked on someone's forehead or their scalp, and they will have a black eye or 2 black eyes, and they could have a lot of eye swelling. And sometimes it's something that they don't expect because we didn't work in the eye area. But anytime on the nose, or especially the forehead or upper face, the swelling can settle in the eyes. So that's something to be aware of. On the lower face, it's not as much of a concern, but in the lip area, also a lot of swelling in the postoperative period. So eating and drinking are usually not the hardest part. Usually it's smiling that causes people the most pain and tenderness after a lip procedure. But ice and things like that and milkshakes definitely help.